CCGHE is the only center that I know of that's doing this kind of thing. The genius of it is that you're taking physicians who are really good at doing their job, good at taking care of patients, good at teaching, but we don't know a whole lot about how to take that product and bring it to a new place. And what Dr. Bollinger has been able to do is have this vision for taking the fundamentals of patient care and teaching that we do at Johns Hopkins and spread it all over the world. And I'm not aware of anyone else that's doing that.
Well, the mission of the Johns Hopkins Center for Clinical Global Health Education is to provide training to healthcare providers in resource-limited settings around the world. There's a tremendous need for additional training and for additional healthcare workers in places that are facing the greatest burden of diseases. And that's really our objective. We're interested in using cost-effective and sustainable technologies and the very best content that we can provide to healthcare workers.
In Uganda, just more like in the rest of Africa, we have one doctor for every 65,000 people. And therefore, many low-income countries have relied heavily on what you would call a health assistant or midwives or registered nurses to actually deliver care, particularly in the rural areas. And therefore, training those individuals while being able to be where they actually work is very critical in terms of skills building, but at the same time increasing their availability of being at work. So this is why short-term training, long-distance training is extremely very critical.
Most of these settings are so overstretched that the resources that they have can only be used to provide the basic care. So we at CCGHE provide a model of capacity building and empowerment so that healthcare workers on the ground can obtain information in a timely and relevant way and provide the very best prevention and treatment practices.
It's a unique type of link that involves use of some novel technologies through the internet and other distance learning tools. That would provide access to some of the world's experts in clinical care and education to people that ordinarily would not have access to that type of expertise.
And this way we have a model where we teach a person to prevent and treat without just sending them the medicines.
I'd like Dr. Bartlett maybe introduce himself and some of the folks at Hopkins to the people here at the Malacca and IDI.
Well, so I'm John Bartlett, and there's a number of people in the audience.
Our group has a lot of experience as well, not only in the use of these technologies, but most of us are engaged in activities in other countries that give us a unique perspective on how to do that and how to target the educational programs to the needs of the communities in which we work.
How about there, Bob? Anybody want to, do you guys know the diagnosis?
I don't think everybody does. Some of them do. Does anybody want to add to the differential diagnosis?
Well, the telemedicine program fulfills a need that would be very hard to fill in other ways. One is that we think that the best learning experience there is with discussions in the context of a case where many authorities get to weigh in on issues of clinical relevance to a clinical audience. And you always learn in these, you always learn. And that's the format that's used here. It's 3 cases a week, we're up to case 165. I mean, it's pretty amazing. But it permits a person-to-person contact that is very hard to achieve any other way, and look at how efficient it is. And we do it every other week, and so I feel like my colleagues in Ethiopia have become friends because of this activity, and that's quite an accomplishment.